keep doing the creative things and the things that are weird. That's been my career. It's how I ended up here. I never shied away from an opportunity. I thrived on the things that didn't fit in the normal traditional box of healthcare administration. I think it's that, just not to be afraid of the things that are different.
I know that there's a lot of advocacy going on, but what's your take on that kind of in the current market? Like,
last year we got a reprieve. So, the reality is Medicare has cut the fee schedule consecutively the last 5 years. We are facing a 2.83% decrease, which for orthopedics, it ends up feeling like 2.9% because of the mix of codes. So closer to 3%. And that's an over 10% decrease in reimbursement over the last 5 years for physicians. But last year, it was supposed to be almost 3%. They came back after Q1 and gave us reprieve and made it half of that, which is, it wasn't everything, but it was better. It hurt less. But the problem is what people don't realize is they're like, well, that's just Medicare. And I end up explaining to people, there's so many fee schedules tied to current year Medicare. So it is all your government payers. So it's your TRICAREs, your state Medicaids a lot of times are tied to current year Medicare. Not always, but some things. Your workers' comp is tied to Medicare and current year Medicare. It's a percentage of it, but it's still, and different states have different percentages, but all of them use that as kind of the litmus it just makes it easy for them. They're like, we just do these percentages of current year Medicare. So when you start looking at it that way, and some people do their fee schedules tied to it, but that includes your Medicare Advantage. There's also a lot of push when we talk about authorizations by the Medicare Advantage companies because they're incentivized to enroll people, where we talk about that, the traditional red, white, and blue Medicare is a much better product from our perspective because the authorization burden is a lot less. We get paid quickly. We don't have to jump through hoops. It's very rare that I have maybe done 2 billing complaints in my 20-year career to traditional Medicare. And they were just little errors and they fixed them and they made it right. Medicare Advantage, the percentage is constantly increasing, the people that move to Medicare Advantage, and our authorization burden is high. So a couple of things in advocacy. One is all physicians should, join their society. In the case of orthopedics, it's the AAOS. Please join in. Please share it with your patients and point out that, your point is not to be greedy, but your point is to protect patient access to care. Because what ends up happening is people end up limiting their schedule for Medicare patients and so it's longer wait times because they're like, if I'm going to get paid so much less, I can only see so many a day or
they
a
don't
week.
Accept it at all.
Yeah, that's the other, I hate to, say that, but that is the other option, is just not to treat them.
Yeah.
It also makes it, so join the advocacy efforts, share it with your patients. When patients complain about their wait time, share that with them. When they complain that you don't have enough PTs, again, say, this is why it's making it hard for us to add people to our schedule. Add people to our staff. So thus we can't add people to our schedule. And then for some, as you mentioned, they're leaving. Separate from, joining the advocacy, sharing it with your patients so they can also advocate. I think people need to start thinking about other relationships, which gets into value-based care. Are you participating in ACO in your community, and are they sharing money with you and pointing back at them? As you work with these Medicare Advantage companies, you do have the option to ask for a higher percentage of Medicare. Sometimes people don't realize that. They won't all give it to you, but it is an opportunity, and you should be taking that, and you should be pushing back. You also should be pushing back against authorization burden and educating your Medicare patients when they struggle to get something authorized or to get a medication they need for the injections that we do. The different Medicare Advantage make it very difficult to, they all have their different preferred drug. It's very frustrating. It's a lot to keep up with. And reminding your patients that they don't have to move to a Medicare Advantage. So they could go back to the red, white, and blue. And I realize that's an end of year discussion with patients, but kind of putting that in their head that they could go back and then do a supplement as opposed to doing a Medicare Advantage. So sorry, that was probably a long answer.
No, this is helpful. I'm learning as you're talking about it. Thanks for tuning in to the Healthy Careers podcast. In 2024, we reached over 32,000 listeners and ranked in the top 15% of all podcasts. We're proud to have SharePro Health as a sponsor and are currently looking for 2 more partners in 2025. If you're looking to connect with healthcare leaders, providers, and innovators, we'd love to spread the word about your service, product, or business. Reach out to me, Maddie, for more details. So tell us a little bit more about the relationship building side with these insurance companies.
I get to know them. I get to know my counterparts. I know about people's dogs. I know about people's cats. They know about my dog. We share pictures and we build a relationship. But more importantly, I also listen to their pressure points and they listen to mine. Like, hey, these are what I'm struggling with. And I try to be really reasonable. Sometimes, as I mentioned at the beginning, I get providers who'll be like, hey, I'm ready to go do this myself. I've been paying a third party because they're a smaller group or they're by themselves and they've paid a third party and they're like, I'm going to go get them. And I'm like, oh, no. And they're like, it's like buying a car. It's like, no, depending how you buy a car, it's not. You could be successful by being unkind for, one round of negotiations. But at the end of the day, you need to build a relationship because you want to talk about the creative things. Because value-based care is where you kind of make up for this work, this declining reimbursement, the fee for service, the question that our system's broken. We do joint bundles and we are the owner of the bundle. And that's a great opportunity. We show ourselves by building these relationships to be creative as they're thinking about policies. You want to be the person that they call. My favorite thing that's ever happened to me in my career of working with an insurance company is during COVID, I was working in behavioral health doing eating disorders with a specialty hospital system. And the president of one of the Blue Crosses in another state messaged my CEO and he said, I just wanted you to know how nice it was that we could call Nikki and ask her opinion on a policy. And she connected us with your clinicians. And we knew she wouldn't try to ask us for more money. She simply would help us collaborate so we could get patients taken care of during this crisis of COVID. And that was like my favorite email that I've ever gotten was when she forwarded that to me, because that's what it should be. It should be that you have that good of a relationship that we can talk about policies and talk about actual patients. And I always give them patient stories. That's something that people forget to do. And that helps them. And you want the person that's doing the other side of this to feel connected to the care. Because if you can personalize the care for them, that really helps the conversation. You can't just say, I need more money to pay my staff. Like you need to, like in the case of the PT authorization, like I spent a lot of time talking about the opioid epidemic and like, this is the effects of this, of us delaying treatment or us eating the treatment, which is what we were doing. But because we didn't want to provide bad care, but you have to explain it.
Yeah. I mean, there's